name is Tricia Hazeliger and I work with the Upper Hume Primary Care Partnership, and I have done for a number of years. And the partnership has a strong commitment around working with agency partners and communities to actually improve the way that people have a say in their own health, both at an individual level and also at a systems level, like with agency planning. We have a particular focus around doing capacity building, learning how to involve people from marginalised communities. So the Building Multicultural Health Partnership came out of that sort of a discussion. One of the things that we thought we would do is actually work with the communities to build their ability to actually have a say, both individually but also in community advisory groups, in focus groups, in different kinds of processes that health services particularly use to get information. And then at the same time work with the two major health services, so that's Albury-Wodonga Health and Gateway Health, to actually improve the way that they partner with the local community, so that the learning was on both sides and was together. It wasn't just kind of like trying to work with one part of the system. What we decided to do was to actually bring a planning group together that would, so we'd invite the partners in from Gateway Health and Albury-Wodonga Health, and then we would invite people from the key refugee communities and also a couple of the multicultural communities to come and join us. And out of that planning, that co-design planning approach, we decided to run 3 agency workshops and 3 community workshops. So we had great turn up with the community workshops because they were on a Saturday. The Albury-Wodonga Ethnic Communities Council, who was a key partner, they actually had some extra money to actually make sure that people had gift cards to remunerate them for their time. People spent 3 hours here of a Saturday. A lot of people had children, so we organised childcare, and we also were here over lunch, so we organised food. And the way that we've worked over time is to make sure that if we pay for childcare, if we pay for catering, that as much as possible that money goes back to the communities. So I guess one of the things that I think we did differently with this project was thinking on multi-levels about how you actually build the capacity and work with the community. It's not just about inviting them into our space, it's actually, which this was at Gateway Health, but also about doing that in a way that was of benefit to the community on a number of levels.
For Albury-Wodonga Ethnic Communities Council, as a community advocacy officer for that organisation, some of the benefits that I saw come forward from this project was the strength and ability for our multicultural community to be cultural advocates for their own communities, to see people come together from the diverse communities around the table and be given the time and the patience and the care that's required to break down some of the ideas that are not as accessible to some of the more emerging cultural communities about how they can participate in contributing to making sure that our health services are accessible and usable for their communities. So I felt like it was an opportunity to really see the culturally diverse communities just get in there and say what they needed in a really safe space. That provided opportunity for them to learn, but more importantly, opportunity for them to contribute cultural knowledge that they have, the lived experiences of their cultures and their communities, and to offer that to the health services and give them an opportunity to reflect on how they could be doing their businesses better.
I think that the project was run really well from the start. I also participated in the steering group. What was really valuable and a learning for me also is the way that Tricia operated that steering group, so that it was very flexible to all of the needs of the members, but to also the needs of the people that were participating. So the time that it was held, people could bring their kids in, all of that kind of stuff, which actually really made it a community-led project, not a project from an organisation saying, oh, you know, here's a thing. So from that perspective, it ran really well. I participated in all of the days, and they were all fantastic, run beautifully. The community members that were present felt that they had the opportunity to participate if they wanted to, didn't have to if they didn't want to, people weren't forced. And it was just a really good vibe. The way that things that were included like transport and childcare, the catering from local communities was just fantastic, because in any sort of project like this where you're bringing together disparate people, the chance to talk over food is a real connector. I think it was great. So through the project, we ran a focus group with the participants, and we asked a really simple question, but it appears simple on the surface, but is really important to Gateway Health in actually understanding from the perspective of the people of all the communities that were involved, what would make Gateway Health a warm and welcoming place. And we got brilliant feedback, as did Albury-Wodonga Health, about things that we can change, something small, something's big, so that people can actually feel that they can walk in, be welcome and get their needs met.
The impacts of the workshop, I think, is it made me think about the community more. When you come in to attend, you meet people with diverse backgrounds, different age groups, and you discuss ambiguities about the services. You become more involved, and as a young person and a person of color, I can tell you that it is really helpful, even if it's just finding where to seek help for counseling, etc. Yep. I think the workshop structure itself is really good. We discussed the issues as a whole. We brainstormed ideas into a focus group, and I think that's about it. It's really nice, and I really enjoyed it.
When we came here, we met other people from India, Asia, and it helped me understanding what they are going through and what they are facing and comparing to my culture. It has helped them gain skills on how they can maybe get some languages, and they can read some signs. Most of the people don't know that in hospital we have signs telling them this is what you can do, but it has gained that they can understand where they can get information and the help they need to settle here in Australia.
I think there's been two impacts for me, Glenda. So the first one has maybe been that I've met people in our multicultural community who I would never have met before, and that's been wonderful. So I think meeting people as individuals in those communities has been fantastic for me. It's really opened my eyes to the challenges that some people face, the different views they have on what healthcare should provide. The second one is that for me it's helped me look at healthcare and the things that we provide through a different lens. So it's helped me see through the eyes of that community. So in terms of things like our written information or our signage or even the way we explain things, it's made me look at that in a completely different way. And from that I've been constantly communicating that to my colleagues and saying it's more than just health literacy. We need to think about what it's like for everyone in our community. I think also some of those people have felt a bit more comfortable about coming in and working in an advisory role with us or even a volunteer role, and I think that's great as well. And we certainly have had a few people who have started coming and working with us in the health service, and we haven't had those relationships before to make that happen, so I think that's been really good.
It's good to understanding about the outcome and services about the health in Albury-Wodonga Health and Wodonga Gateway Wodonga. I already had an interview with the advisory committee and yeah, I'm joining to the advisory committee in Albury-Wodonga to help the people and gain more experience about the health organization.
It's been a great opportunity to network with other people and to provide a different perspective from someone who's worked in several different roles over many years in both the settlement and multicultural community. And it's been wonderful to see the multicultural community themselves be directly consulted, be included, and be asked to participate, contribute, what are their needs, and to be able to be included in an ongoing sense so that their voices are heard directly in the health arena in this sector. It's been really great to see the interaction between people who might not be aware of who's in the community, what the cultural needs are, to grow a sense within the multicultural community of belonging and feeling consulted and listened to, and a sense that it is possible to advocate and move forward.
Being involved in this project from a Gateway Health perspective has been incredibly valuable in the feedback that we've been given about what we can do and start to change so that people understand what we deliver and how they can access it to improve their health and wellbeing.
I mean, I think one of the things I really loved about this project was the holistic nature. Like I loved the fact that there was something for the health services to learn from the multicultural community in terms of their cultural knowledge and their lived experiences from their cultures. And there was equally information for the multicultural community to learn about the structures and systems that are in place within those bureaucratic sort of health systems in order to demystify them to a certain point and allow our multicultural community members to feel like they can understand it and start to participate in the future. So I really appreciated that sort of holistic approach, that it was a two-way learning, and more than anything, I feel so proud about the group that we brought forward through AWEC and support we've given them, and to watch them grow in that environment and watch them absolutely say what they've needed to say in the most safe and supportive environment that you could have asked for. Yeah, it was great.
I think it's been a good thing that the person who thought about it was very knowledgeable and has been thinking about this. It is very important and they should consider it as an important thing, and the government should start supporting it. Thank you.